Okay, everyone. I'd like to formally introduce myself. My name is Mark Carbillano. I'm the Director of Sales for A&B Insurance and Financial. We're a contracted general agency for Florida Blue. We've been in the business for the last 30 years serving our Florida residents. And today's presentation is going to be geared for our Florida residents, talk a lot about healthcare reform, talk about all the areas of healthcare reform that are going to affect you and your family. Make sure that you have a good understanding of how all of this operates. We're going to try and make it sound real world terms for you so that way it's understandable and hopefully alleviate a lot of the confusion and a lot of the misinformation that's going out around the networks, out on the TV, and as you're listening to CNN or you're listening to Fox News or MSNBC, there's always a different opinion that you're hearing. So what we're going to try and do is cut through all of those opinions, deal solely with the facts that are about to happen, and make sure that you're comfortable with the entire process. So when we start off today, what I really want to do is really start off with the basics. I know that we're going to cover a lot of very remedial information. I do apologize if you have a good understanding of these basics, but I really think for lower common denominator, I want to make sure that everyone is comfortable from everything from beginning to end. So as we start, first I would like to talk a little bit about health insurance. And what is health insurance? Well, health insurance is basically an agreement that is between you and an insurance company to pay for the costs of your doctors, hospital visits, prescription drugs, tests, maternity care, other health services that you may need. And we call this our health care coverage. Everybody needs to have some health care coverage at some point in time in their life. Hopefully we're all in a situation where we're healthy and we don't have anything to worry about, but it does come up at some point in time in our life where we are going to need some sort of assistance financially, and we do this through our private insurance companies, we do this through our group insurance or employer-sponsored plans as well. Now, when you get your health insurance, this is a contract between you and the insurance company. So it's not something that can be changed. If you read that contract and you understand that contract, you'll pay some sort of monthly bill, and we call that a premium. Those premiums for your health care plan and the insurance company, that means that the insurance company is agreeing to pay what is listed in that contract based upon the agreement or the contract itself. Now, as we're moving to healthcare reform, as we begin this presentation today, there's some very important definitions that I want everyone to understand. These definitions are going to be carried out throughout our presentation today, and hopefully will give you an idea of understanding as you hear different terms like qualified health plans and, as you see here, the marketplace. So the marketplace is the first definition that's important to you, and that's going to be an online place where you're going to purchase your health insurance. This is the only place or the only area that you are able to obtain your subsidy. Now, that subsidy is going to be an amount of money that is going to be given to you by the government in order to help pay for your monthly premiums. Now, the subsidy amounts are going to be based upon your adjusted or modified adjusted gross income, which we'll talk a little bit later on as we get through this presentation today. But understanding that the marketplace is the only place where you'll be able to obtain your subsidy is really the crux of what a marketplace is. And in the state of Florida, we are using the federally facilitated marketplace. And all that means is that the government or the federal government has assisted the state of Florida in creating this online platform to where you can obtain this subsidy. Another important definition is a grandfathered plan. Now, a grandfathered plan means that you can keep that policy. Grandfathered plan means that your current insurance policy was purchased before March 23rd of 2010. And if you had purchased an insurance policy before March 23rd, 2010, and have made no benefit alterations, no changes in deductible, no changes in benefit structures since that time, then you can keep that plan if you desire. Now, there will be rate increases and changes and what we're calling migrations to qualified health plans in order to stay with that grandfathered plan, but you should understand that you do have the option to keep that policy if you purchased it before March 23rd, 2010. Now, the last definition is the one that nobody likes, but that's called a tax penalty. Tax penalty is something that we are going to have to pay as Americans to the IRS if you fail to have a qualified health policy after January 1st, 2014. As long as you have a plan that you have purchased, either grandfathered plan or a plan that is in force before January 1st, 2014, it will help you avoid a tax penalty on your next filing or when you file your next year's taxes. And we always know that the IRS is going to collect their penalties when they offer them. So, probably one of the first and biggest questions that I get when I'm talking to clients and we're talking with folks is, what happens if I have coverage now? Well, how are you going to be affected if you currently have a policy? You are going to be able to keep that policy through the anniversary date, which is going to be sometime in 2014. Or if you currently have a group insurance policy, that policy you can keep. You can keep that group insurance policy. You can have the plan now and keep it through 2014 based upon the anniversary date of your policy. If we were to look at Florida Blue and how Florida Blue treats those anniversary dates, for our Blue Options programs, those will be good until the summer of 2014. And during the summer of 2014, at that point in time, you would have the opportunity to transfer to a qualified health plan on the marketplace and receive your subsidy if you qualify for one. And when we talk about how long you can keep that, different carriers have different anniversary dates on their policies. So if you have a private insurance individual policy, not through your employer, you are going to be able to keep that policy to that anniversary date. You're going to want to check with your current carrier on what that anniversary date is. At this point, as we're so close to the annual election period starting, you may have already got some letters or documentation or different things telling you about what those anniversary dates would be and exactly what your options are. So, what I'd like to do is talk a little bit about if you have coverage now. I'd like to play a little video for everyone, and this might help clear up a lot of confusion. So let's start with this, and then we'll carry on to the next slide.
The new healthcare reform law, the Affordable Care Act, brings a lot of changes, and we know you probably have a lot of questions. Florida Blue is here to help you understand what's new and what it means to you. Starting January 1, 2014, most everyone in the U.S. is required by law to have health insurance. So if you already have insurance, what happens to you? Well, if you're paying for it yourself, the good news is the government might help you pay part of your monthly health insurance bill. That help is called a subsidy. And later this year, you'll be able to go online to see if you qualify for a subsidy and how much it will be. That's great news. If you don't want to wait that long, you can go to floridablue.com right now to use our subsidy estimator that will give you an idea of where you stand. Whether you qualify for a subsidy or not, October 1st, you'll have some new health plans to compare and choose from. Those will be available in the new marketplace and from insurance companies. Florida Blue experts are available to talk to you one-on-one to help guide you through the process. And if you've had the same plan since March 2010, you may be able to keep it. Talk to us to see what your options are. Finally, if you have coverage through your job, you don't need to do anything. Most companies will continue to offer insurance. Turn to us if you want to learn more about your health benefits or healthcare reform changes.
So just a little information that you can get to learn a little bit about. I hope that was a little helpful video. And with that, it really kind of explains to you what's going to happen. And as you did, you hear some mention of the marketplace and October the 1st and really all of these changes being able to be applicable at that time. So let's talk a little bit about the marketplace. Let's get into some meat and potatoes, so to speak, on some different things that are important to everybody. So all of the plans were released a couple of days ago, so we're going to talk about some of the plans as we get further in the presentation today. But the marketplace is going to be opening on October the 1st of 2013. Any policies that are enrolled in an application that is taken between October the 1st and December 15th, you will be able to use that insurance on January the 1st, 2014. Now, this is the first time this has ever happened in America. The opportunity for guaranteed issue medical with no riders, no restrictions, and the goal is to insure as many Americans and many Floridians as we possibly can. Because as we all know, insuring and having insurance is a very important piece of our lives because you can never protect yourself enough from the unforeseen. So the open enrollment this year will run through March 31st. Gives us a little extra time to get everybody insured and get everybody taken care of. As I said, the marketplace, or what we also call the exchange, depending on when you start hearing these terminologies, well, with that, it's the only location that you're going to be able to get your policy with reduced pricing with that governmental subsidy. Now, the subsidy is also being referred to as an advanced premium tax credit, which can get a little confusing and how that really works. But for all intents and purposes, and what you need to understand is that subsidy is an amount of money that the government is going to give to you, and they're actually going to give it directly to the insurance company on your behalf. I've had some comical conversations where say, well, where is this marketplace? Is it at the mall? Do I have to go there? No, it's an online location that you work with an insurance agent, so that way that insurance agent can clearly describe the benefits, how those benefits are going to work, and that way you can do your enrollment and get that governmental money that is due to you based upon your income. One of the really interesting things that we have in the state of Florida is that not all carriers are going to be practicing and offering coverage on the exchange or on this marketplace, meaning that you're going to have limited choices. Some of the carriers that offer insurance policies in the state of Florida have made a decision not to do business with all of our Florida residents. So let's talk a little bit more detail, a couple of little slides here that we'll go through on the marketplace, and hopefully this will clear up any confusion that you might have had.
You can do all the things you do with more peace of mind, less worry, and more financial security when you know you've got health insurance. And now everyone will be able to find health insurance at the Health Insurance Marketplace. It's an online shopping site where you shop for health insurance that fits you with low cost and even zero premium plans for those whose income qualifies. If you or your family are uninsured or just looking for better coverage, you can see your options all in one place with one application. It's a place to compare a wide range of quality health insurance plans, to review them all side by side, and choose the one that's right for you. You'll find the information clear and easy to understand. You'll explore the marketplace at your own pace. You can compare prices and benefits, see an explanation of what a premium is and what a plan will cost you every month before you make a choice. And every plan will cover you with comprehensive benefits, from your visits to the doctor or the hospital to your prescriptions, to screenings for cancer and other conditions. And no plan can turn you away even if you already have an illness or condition. The Health Insurance Marketplace, part of the healthcare law. Opening October 1st. You can learn more right here, right now. And be ready for the new world of health insurance shopping.
Now, one of the things that I want to touch on as we talk about the marketplace and as we move through this presentation is that the marketplace can be a very confusing area. You know, there's going to be a lot of talks about subsidies, there's going to be talks about benefits, copays, deductibles, and how different things work, and it is very advisable that you work with an insurance professional or someone that can help you and guide you through this process. You've probably heard terms out there such as navigators and other people that can assist in this process. I've been in the business particularly for quite some time, and I know how confusing insurance can be. This is not a simplified process. This is something that you need an expert or a professional to help you through and understand how it's going to work. It's simple when you really think of it, that I would not ask my friend, my neighbor, or someone that didn't know anything about legal to give me legal advice. I wouldn't be very comfortable with doing that unless I was talking to an attorney. Or it's very simple. I don't use WebMD to try and figure out and diagnose what's wrong with me, because that can be very scary as well. You start reading some of those articles, and the next thing you know, you have some strange illness that no one's ever heard of before. So it is important that you have proper guidance and that you're working with a professional in the marketplace. So we referred to this term subsidy several times, and I want to really make sure that you understand, how are you going to identify what your subsidy is and how that's calculated. Well, when the government is going to offer this help to you, they are going to help you, and it's going to, as I said, be referred to as a subsidy or an advanced premium tax credit. In looking at that, the way that they're going to calculate the amount of subsidy or the amount of money you're going to get is based upon your household income, or in that household income as filing of your modified adjusted gross income. They're going to look at your family size and individual ages, where you live, and yes, unfortunately, tobacco use. They're going to use this information very simply to identify whether you're going to qualify for extra help in the form of a subsidy. And once you qualify for that subsidy, that's going to be paid directly to the insurance company. There are a lot of misconceptions out there that you're going to have to pay the full premium and then you'll get it back on your taxes. Well, you can choose to do that if you'd like to. However, it is not necessary. Those monies will be paid on a monthly basis directly to the insurance carrier of your choice. So, what is a subsidy? Let's take a few seconds. This is a very short video on what a subsidy is, and I think it'll also describe to you and make you understand that a little bit better.
The new healthcare reform law, the Affordable Care Act, brings a lot of changes, and we know you probably have a lot. Florida Blue is here to help you understand what's new and what it means to you. So what is a subsidy, and how can it help you pay for health insurance? Starting the 1st of next year, almost everyone will be required by law to have health insurance. The good news is, if you qualify, the government may help you pay part of the bill for your health plan. That's called a subsidy. So who qualifies? That depends on things like your income, age, where you live, and the size of your family. If you don't want to wait until October 1st to use the government subsidy calculator, Florida Blue has experts you can talk with one-on-one and an estimator of our own on our website at floridablue.com. The subsidy goes to your insurance company, so your monthly health plan bill is lower. Here's how it works. The estimator tells you if you may qualify for a subsidy. Let's say you do, and it's $183 a month. We help you pick a plan with the right coverage for your family, and it costs $334 per month. That's when the government subsidy kicks in. So, you subtract that, and you're getting $334 in coverage for just $151 a month. However, you may still have to pay part of the cost of your medical bills. One last note. People getting insurance through their job don't qualify for a subsidy. Turn to us if you want to learn more about your health benefits or healthcare reform changes.
So typically at this point in a conversation, everyone gets a little alarmed with that last sentence about how if you work for someone or you're employed and you have benefits, that you're not going to qualify for a subsidy. And we're going to cover that in a few minutes and let everybody cool off if that's excited you a little bit. And we'll talk a little bit about how that's identified and how that's going to affect those that are working. But let's first talk a little bit about those subsidy levels. So when this chart, when you look at it, it can be very confusing. It can be something that kind of scratch your head a little bit and say, well, what does all of this mean? But let's go through this chart together so that way you can understand. Well, what has happened is the government has dictated through the Affordable Care Act, which is law, that the insurance carriers can only charge a maximum or a certain amount based upon your income level for your health insurance. Now, when you're looking at that and you're making that decision and you want to try and calculate what your subsidy amount would be, this chart on the left is going to identify how many people are in your household. As you see, 1 through 8. Now, as we move to the right of the chart, you'll see different income levels. Now, with those different income levels, what's going to happen is that the amount of your subsidy is going to change. And we can calculate that, and I'll show you an example so that way it'll be a little clearer. But for example, once you get over $45,960 as a single individual, you are no longer eligible for a subsidy. So you won't be getting any extra help from the government if you make over $46,000, $45,960. That column over on the right-hand side is very important because if you're thinking about your particular family and how much money that your family makes, and that is a family income that we must be mindful of, if you are a family of 4 and your family is making under $94,200, you are going to get some help from the federal government to pay for your insurance. So there are a lot of people that this particular program is going to help and provide much more affordable coverage for those individuals. Now, if you look at this chart up on the top, you can see a percentage. Now, what those percentages are is the maximum amount that you could be charged for the cost of a silver plan on the marketplace. Oh boy, what does that mean? Well, as we look at the marketplace plans in some further slides, there's going to be different metal levels, different colors, different brands, so to speak, and they're going to be bronze, silver, gold, and platinum. Now, in the law, what has happened is they have told the insurance carriers that if you are, for example, making $28,725 a year, that the insurance company cannot charge you as a single individual any more than 8% of your income, or 8.05, for your health insurance for a silver plan. Now, mind you, I said there's a couple of different layers there, a couple of different levels that you can migrate to. What that means is with that silver plan, you can buy up to a gold, pay a little bit more money, or you can go down to a bronze and pay a little less money. So this chart is something that our professionals, our agents in our office will use to work with you to identify how much money you and your family will pay. And this is an estimate that we use to give you an idea or a guidance, because those specific premium dollars won't be available for us to show you until October the 1st. But know that a conversation with one of our agents, one of our professionals, they can sit with you, have a very basic conversation, identify some very basic needs, the size of the family, what is the family's income, and tell you what you would pay for your health insurance in the new age of healthcare reform. So it's very important. And as we get down to our lower incomes, when we are dealing with the 100 to 250% of the federal poverty level, well, at that point, you are also going to get a cost share. Now, a cost share means that what we're going to do is the insurance company is going to reduce the size of your deductibles and reduce the size of your copays to accommodate a better policy at an even lower cost. Now, unfortunately, with healthcare reform, we are still unable to help people underneath 100% of the federal poverty level. In the state of Florida, with Medicaid expansion and the things that have gone over and throughout the news, there's been a lot of talks and a lot of controversy with the government and the governor. Should he have taken the money? Should he have not? Well, the way that it's set up in the state of Florida is we will be able to help anyone with a subsidy between 100 and 400% of the federal poverty level. Anyone under 100% of the federal poverty level would not be applicable for a subsidy. They could get a qualified health plan, but no subsidy or extra money from the government would be applied. Just as if you were over 400% of the poverty level, then you would also not qualify for a subsidy. However, the beauty of healthcare reform, qualified health plans that are being released, is that everyone will be able to get a guaranteed issue policy with no medical underwriting, no medical questions. Underwriting is going to go away. and you'll be able to have a qualified health plan with a lot of core benefits that will be very exciting and protect our Florida residents. So as I said, people underneath the 250% of the federal poverty level will also get extra help in the form of lower out-of-pocket expenses, a lower maximum out-of-pocket or financial responsibility that you would have in the worst-case scenario. And in addition to that, lower deductibles will also apply. I want to give you an example of what this looks like in real-world terms. So what I've done is I've put together an example here that can hopefully help you understand a little bit better about how this all works in the real world. So let's take an example of John. And John makes about $17,000 a year, and he's a single guy somewhere around the age of 40. Now, his projected annual income is $17,000. This is an estimate. This year, the way that it works is that we are going to be on the honor system for declaring our income on the marketplace. You will square up with the IRS at the end of the year, which can be a little scary. Now, what we're doing is we're estimating some premiums for him, and this is really just an educated guess on what those premiums would be. But let's just say that his unsubsidized premium for a 40-year-old would be $4,500. Well, based upon his income in the chart that we looked at earlier, the maximum amount that we would be able to charge John is 3.8% of his income for his health insurance. And at 3.87%, that means that John would have a monthly premium of $54 a month. Now, his governmental tax credit or his subsidy would be $3,842. Now, in addition to that, because John is underneath 250% of the federal poverty level, he's also going to get an increased benefit package, meaning that his maximum out-of-pocket will be reduced to only $2,083 a year. Where someone else in the same situation as John making more money may have a maximum out-of-pocket of $6,000 a year or $4,000 a year based upon their income as well. So it's a good example of how things are going to play out inside the marketplace and how both benefits and premium dollars will be adjusted based upon income. So if I enroll, when does my policy start? It's a great question. Get asked it all the time. If I enroll in a policy between October the 1st and December the 15th, my policy will be effective of January the 1st, 2014. That means that on the first of the year, I can start using my policy. However, if I miss the December 15th date, I can start enrolling on December 16th, and enrollments between the 16th of the month and January 15th, then your effective date will be February the 1st. And as you can see here, I've listed out some other enrollment periods all the way through May 1st. Now, what you do want to understand is that failure to have that policy in force or have a policy in force by January the 1st, 2014 can and will result in a tax penalty. We'll talk a little bit about that later. What you also have to remember is that this is not just an enroll anytime kind of thing. Those of you that may have experienced working with Medicare beneficiaries, or if you've got mom or dad who may be on Medicare, you know that they have an annual election period and changes can only be done during certain times of the year. Well, that's what we're going to be dealing with in the Affordable Care Act as well. And what that means is that if you don't get a plan by March 31st and you don't have a policy enrolled and in force, then at that point, you would miss the election period, and you would have to wait until next year to enroll in a qualified health plan. There are special circumstances, which we refer to as special election periods, and those are things like getting married, having a baby, moving into a service area, moving out of the state or a different location. So those of you that are thinking, well, I'll just get a divorce to get my enrollment period or special election, that probably may not be the most inexpensive way to get your health insurance. So you probably want to just enroll during one of these enrollment periods and make sure that you have something in force for yourself and protection for your family. So if I don't enroll, then I'm going to get a penalty. A lot of controversy in the marketplace about this. Hear it all the time on the radio. Hear it all the time on the news talking about how it's unconstitutional. However, it's going to happen, and there will be a penalty for not enrolling. A lot of people who are delivering the rules about the penalties are incorrect, so let's clear it up a little bit. In 2014, 2015, and 2016 and beyond, the penalty will be increasing. Now, I cannot tell you whether they're going to stay set in stone in 2015 and 16, but I can tell you what they are in 2014 and what they're projected to be. However, I would anticipate that there will be some sort of changes on these, and we'll have to wait and see how that all happens. In 2014, the penalty is going to be $95 for each adult that does not have a policy. Not very much. $47.50 for each child, and a maximum of $285 for a family. Not so bad. However, if it's 1% of your family's income, and whichever is greater. So a lot of people are saying out there in the marketplace, oh, I'm just going to buy this short-term medical policy, which is non-qualified, no big deal. I don't want to deal with all of this qualified health plan mumbo-jumbo. I'll just pay my $95 penalty. Well, if you're making $100,000 a year, it's going to be 1% of your income. It is not going to be $95. It's whichever is greater. In 2015, those penalties are going to increase to $325 per adult, $162.50 per child, or 2% of the family income. Again, whichever is greater. So that's where everybody gets a little confused, and it's something that you want to make sure that you're comfortable in understanding. Get yourself some insurance, have the protection, because again, if you miss the enrollment period and July rolls around and you get diagnosed with cancer and you don't have an insurance policy, and now you want that insurance policy, that qualified health plan, guaranteed issue with no medical questions, you can't get it. You're going to have to wait until October to have a January 1 effective date. So it is something that you want to make sure that you have set up for yourself. And the penalty, even though it's small, it would add up because it is the greater of the percentage of the family income, $285 maximum for the family, but that 1% is where it's at. So what are these plans going to look like? Now we're going to get to some exciting things, because now this is some information that we haven't had in the past, but now we've got it. Okay, all of the plan designs have been approved by the IOR. The federal government has examined the programs. They're ready to go, and they have been released, and we can now talk about them. Some of the core things that you need to understand are what's called essential health benefits. Now, essential health benefits are going to be our guaranteed issue provision, no waiting periods for any of the policies. The day that you get it on January 1st is the day you can go use it. There are no pre-existing condition waivers, meaning that we're going to cover you fully no matter what's going on in your health. You could be 450 pounds, smoking, you could have just had a lap band procedure, diabetic 3 times over, and it won't make a difference. It doesn't matter what the health conditions are. It doesn't matter if you've got pins, plates, or screws. There's no exclusions, and there's no rate-ups for conditions. So any high blood pressure, cholesterol, or things like that that you may have on your policy now that they're charging you extra premiums for, well, they all go away. Unisex rates are also going to be coming out as well. That means that a 37-year-old male and female will pay the exact same rate. The ladies have been getting a raw deal for the last few years. They always pay a little bit more, but now everything is going to be on a level playing field. We are going to include maternity benefits on all of our plans, and all the ladies that are on our plans will have maternity benefits. RX coverage in all plans, as well as 100% wellness coverage, and that's for all preventative care benefits, not subject to a deductible or a copay. There's not going to be any annual or lifetime maximums on the policies, and we will have a maximum out of pocket of $62.50. That's a typo. And you will have that for individuals, and all out-of-pocket expenses will count towards your maximum out of pocket. Also, what you're going to have to understand is mental or nervous conditions are covered on all of our programs, and there's some other core benefits that our agents can go through with you. And for today, we're going to move right into what the plans are going to look like. Now, you heard me mention some colors before, or some metal levels. We have bronze, silver, gold, and platinum. And there's 4 levels of protection are going to really dictate the level or quality of insurance that you have. The bronze being our lowest level of plan, platinum being the highest level of plan, and Florida Blue is the only carrier that's going to have multiple options on every metal level. So it's very important that you understand these different levels. And as we talked about the cost of a silver plan before, that's our second tier, and that silver plan is probably going to be most interesting to a lot of us, depending on health conditions or what you might have going on with your family dynamic. So some of the options that we're going to talk about that Florida Blue is going to be releasing is going to be an all copay plan, a predictable cost plan, something that we're calling an everyday health plan. We also have an essential health plan and an essential HSA. For those of you that are currently on HSA plans now, you will have options on a qualified health plan to also be covered on an HSA qualified plan. So let's get right into the plans. Let's talk a little bit about them. Our all copay plan is probably the most exciting plan that you're going to get out there, the most benefit-rich policy that I've seen released in my career. This policy is going to have a 0 deductible. This policy is going to have copays for all services. So whenever you get anything taken care of, you're just going to pay a flat amount. You are going to have no balance billing on most of our networks, and that means that when you pay a copay, that's all you're going to pay. And with this particular policy, that's all there is. There's no coinsurance that you have to worry about, none of that 80-20 mumbo jumbo that you've probably heard. Now, with all of our policies with Florida Blue, we've brought some of the most dynamic coverage when it comes to RX. And when I say RX, I mean prescription drugs. The prescription drug coverage that comes with all of our plans we're referring to as the Value RX. The Value RX are going to give you $4 maintenance medications, 0 generic maintenance medications through mail order, and half price maintenance medications that are brand. That comes with all of our plans. This particular all copay plan, which is very exciting, ER copays, low copays for your specialist and your PCP, preventative care coverage, is only available in our platinum level. This is the Cadillac of policies, so to speak. It does not get any better than this in the marketplace. $0 coverage for you, where you're going to pay no out-of-pocket expenses for all of your preventative services. If you are dealing with diabetes or chronic conditions, we're going to talk a little bit about some value-added benefits for chronic conditions, but all of those services are going to be free. DME, which is your diabetic testing supplies, your durable medical equipment, all covered at 0. Your lab testing using Quest Diagnostics covered at 0. And then also with healthcare reform, we will be covering pediatric dental and vision on our plans as well. So very exciting all copay plan. One of the plans that I'm personally most excited about is our predictable cost plans. Now, our predictable cost plans are going to be available on several metal levels, mostly in the gold and in the silver. And these plans are going to be very benefit rich. And what's really nice about the predictable cost plans is that Florida Blue is going to be offering your first 3 doctor visits at a 0 copay. That means that you get sick, you go to the doctor, you're not going to have a copay to worry about. Now, in addition to the 3 doctor visits at your PCP at a 0 copay, you're also going to get yourself your wellness examinations, and that's also going to be at a 0 copay. Another exciting part of this particular predictable cost plan is going to be a $75 copay at your emergency room. Now, just to be clear on a couple of those items, the doctor visits of 3 doctor visits at a 0 copay, that is per person on the policy. So if you've got 5 people in your family, each one of you are going to get those 3 PCP visits at no cost. The ER, $75 your first time, and then a copay after that. If you're in the silver level or the silver meadow plans, you're talking about $750. If you're at a gold level, $250. And the only difference between the gold and the silver predictable cost plans are really going to be just the amounts of the deductibles and the levels of those copays. And cost as well, as you can imagine. Preventative coverage is still going to be at zero, available in the gold and silver levels only. And I really like the gold level where we have a surgical or an ambulatory surgical center copay at $300. So very exciting plan. This plan is going to be very attractive. It also contains advanced imaging copays, copays for your allergy injections, and a lot of other value in this particular policy that you're going to want to talk to one of our Florida Blue agents about so they can take you through it step by step. Everyday health policies are very interesting. Now, the everyday health policies are a blend of a predictable cost plan and something that doesn't have all of the bells and whistles, so to speak. This particular everyday health plan is going to have some copays. We find that this policy is going to be good for those people who want to go to the doctor for sick visits, managing conditions. But if you've got children and you're going to the doctor on a regular basis and you're worried about surgical procedures, this may not be the best plan for you. If you are fairly healthy, it's a good plan. If you've got children, it's a good plan. Probably my second most favorite policy when we're looking at it, available on several metal levels. We are going to have this available in bronze, silver, gold, and platinum. Now, as you can see by looking at this screen, the variable as you're going through it is going to be the deductible sizes, the amounts of the copays, and your overall financial exposure. Now, when you look at it says deductible there, you can see how that fluctuates, platinum to bronze. And even on the bronze level, with a $6,000 deductible, 100% coverage, 3 doctor visits at zero, $40 after that, and a specialist visit at $60, probably one of my favorite plans for the cost that it's going to be appealing to. At a lower cost plan, the bronze on the everyday health is going to be very appealing to our younger families who just need basic medical care, doctor visits, the earaches, and things of that nature. Now, also with this plan, our Value RX is also going to be built in here, so you will always get your diabetic supplies. You'll always get those preventative medications at $4 or free if you're doing it in mail order, as well as half-price brand name drugs. Also, this policy is going to work very well for our Florida residents. I really like the $5,000 deductible silver plan on the Everyday Health. I find that policy is going to be very strong, very benefit rich. It is missing a few features when it comes to the advanced imaging and some of those other things. Again, our agents that work with us that have sent you to this call today will be very happy to go through all of the details with you and also establish some pricing that you can understand and sink your teeth into. Now, those folks that are looking for a lower cost option, not really too concerned, then we would be looking at an essential policy for you. The essential policy is available in silver or gold. With this policy, it's good for the folks that want to have a deductible, not worried about going to the doctor, because our doctor visits outside of preventative care are going to be subject to the deductible, and then coinsurance would apply from there. This is going to be a lower cost option on our silver side because it doesn't have all of the bells and whistles, the copays that you would normally be receiving. Also, you do have to satisfy your deductible, the normal deductible on the plan of $1,300 or $2,100 before you're going to get your prescription copays outside of the Value RX that's added into here. Remember, the $4 generic maintenance drugs is not going to be subject to your deductible, and your half-price brand names for maintenance are also not subject to the deductible. And if you can get those at a zero cost by utilizing our mail order. So very exciting plan as well. It's just those folks that are trying to save a little bit of money also would like to have something that has a lower deductible and doesn't have all the bells and whistles though. Our essential HSA programs is something that we've always been very successful with. People like these programs available in the bronze or the silver. This is our lower cost option. With this particular policy, there is going to have no bells and whistles. It is going to give you a deductible, and then it is going to be covered at 70% or 100%. It appears that there's a miss on the slide here, so just ignore that bottom left-hand corner. That's incorrect. An HSA policy doesn't give you any coverage except for your preventative care, your Value RX, and everything else on an essential HSA is subject to a deductible. So once you satisfy that deductible of $3,500 or $6,250, then you would be entering in a share of cost at $70.30 on the bronze level at $3,500, or you can go to that higher deductible at $6,250. And remember, when we raise that deductible, we're going to lower that monthly premium for you. And a lot of times what we do is we offset this particular essential HSA plan with some ancillary benefits to protect the family if you have children against accidents or critical illness coverage. And these plans are very appealing to those healthy individuals who don't mind paying a little bit of that out-of-pocket expenses because we're not running to the doctor on a regular basis. Typically not something that is going to be appealing to younger families, or if you've got a child in school that may be getting an earache and running around. Again, the Value RX is still included with that, not subject to the deductible, so you can get those maintenance medications, you can get those 90-day supply generic medications, and again, pediatric dental is always going to be included in these plans. So let's talk a little bit about some value-added benefits. What gets exciting about these plans is going to separate Florida Blue from the competition and from the other people that are out there in the marketplace. It's really the value-added services that we offer, as well as being Florida Blue and really geared towards our Florida residents. So the Value RX, as I've repeated myself probably 10 times, or at least 5 for each one of those last slides, is going to come with all of our plans, not going to be subject to the deductible, and is going to provide you with $4 generic medications retail, 0 through mail order for maintenance medications. In addition to that, you're going to get half-price brands, and that is also going to be at no additional charge and included before the deductible has been satisfied. Pediatric dental and vision, a requirement for a qualified health plan through the marketplace, as well as Blue 365. Blue 365 is a program that Florida Blue has put together that gives you a lot of value-added services for gym memberships, Reebok, different types of savings programs, maintenance maintenance for your health, for wellness, and different things. Now, with that, Blue 365 is accessible on our Blue Cross website, and your agent can guide you through all of the different features of that. There are some clients you get some discounts on Reebok sneakers and all kinds of fun stuff. Chronic care management is something that is very important to Florida Blue, and we are focused to chronic care services, medication, and maintaining the health of those individuals that have chronic conditions. We have a dedication to our diabetics and to the people that are in Florida that have health-related issues, and Florida Blue is geared up and ready to help you with the services that are built into our policies. Chronic condition care is going to be for diabetes, asthma, depression, high blood pressure, cholesterol, and others. Just wanted to highlight a few of the most common chronic condition care, and we have you covered. We have a solution for you with care management. We have nurse lines that you can speak with, that we can make sure that you're getting the appropriate course of care and you're able to utilize the services that are built into your policy that you may not otherwise know how to access. And our agents can really take you through that step by step. Our Florida plans also are going to give you the 0 preventative screenings for routine wellness examinations. That's going to be an annual examination for the men. For the ladies, you are going to get an adult female examination as well as an adult regular examination. So you can go to the gynecologist, and then you could also go to a standard physician or a PCP if you'd like. Those are going to be at no charge. $0 generic oral contraceptives. As I said earlier, a 3-month supply of generic medications through mail order for depression, diabetes, asthma, high blood pressure, cholesterol, reducing the out-of-pocket expenses for our Florida residents. Eye exams, dental cleanings, lab tests, diabetic supplies, and insulin pumps, all at a zero copay. It's very important that you understand that with most diabetic supplies, you can't get them at a retail location. Well, Florida Blue has been dedicated to making sure that you can get your diabetic supplies, your testing strips, and the things that you need at a retail location, you still at a zero copay. You do not have to get those things at a mail order or someone like a CareCentrix. You can go to your local pharmacy that's in network and receive those supplies. Also get your home health care, durable medical equipment at zero, as well as foot exams for our diabetics. We also have the freedom that a lot of organizations and a lot of insurance carriers don't have, with the ability to choose your own doctor, and no referrals are going to be required. Now, on any of our plans, any of our networks, we do not require referrals for any of them. This is very different than what a lot of carriers are doing with healthcare reform and being able to participate in the federal marketplace, and we are dedicated to not having you have to do that. Make sure that you can go to your doctor. You do not need a referral in any of our networks. We are also the only carrier that has the Florida Blue Centers. Our Florida Blue Centers are there for you to get advice. We do a lot of health screenings, one-on-one care where you can go and you can make sure that you're using your insurance in the most affordable manner and making sure that you're not overpaying, controlling medical costs based on conditions. We also do a lot of fun stuff at our Florida Blue Centers as well. On Mother's Day, they will do mani-pedis and all kinds of fun things, clowns every now and then. It's just another way that Florida Blue is giving back to the community and making sure that we are taking care of our Florida residents. If you do have chronic conditions, you'll get personal support for an ongoing health condition that needs care, and making sure that that care is being handled in the most appropriate manner. And remember, all of those generic medications for treatment for the cholesterol, diabetes, depression, and asthma, and there are more, are going to be at no cost. Now, there's been lots of rumors out there, depending on who you're listening to, about networks, and Florida Blue is going to change their network and they're not going to have network availability. I want to diffuse that right now. Florida Blue is a dedication to our networks, and we've been expanding our networks on a regular basis. We are going to continue to have 3 network options to help our Florida residents control cost, and your agent can go through that with you and make sure that you're selecting the right network that provides the hospitals and doctors that you want to see, and be able to make sure that you have the services and the cost, a good balance that's going to work for you and your family. Our Blue Options network is the largest network in the state of Florida, fully portable with the Blue Card, something that comes with that policy, meaning that I can go to any state, including Puerto Rico, even worldwide, and get in-network coverage if I have our Blue Options network. Our Blue Care Network works very similar to an HMO, and that Blue Care Network means that you have to stay in network in the state of Florida for the most preferential services, or you will be paying a higher out-of-pocket expense. Now, with that Blue Care policy and the Blue Care Network, if you should leave the state of Florida, no problem. You are going to have your emergency care that's available for you, and that is going to be available for you anywhere, including worldwide. On our Blue Care Network, you don't get that Blue Card, so you can't go to the doctor and get a checkup or get it checked up for a common cold if you're outside of the state of Florida on Blue Care, but you can utilize emergency room services if need be. Our Blue Select network is going to be our smaller network. With the Blue Select network being smaller, it's also our lowest cost basis, meaning that if you can find your doctors and hospitals and the people that you want to see in the Blue Select network, you are going to save your family a substantial amount of money. Now, with that Blue Select network, you do also receive the Blue Card. That Blue Card is going to allow you to travel outside the state of Florida and also get that same treatment as you would in Florida. I know it's a little odd and it may seem a little off. However, in the state of Florida, you'll have a smaller network, but because the Blue Card comes with the Blue Select program, you will be able to leave the state and get the services that you would like and have it be treated as in-network. So Florida Blue is dedicated to our Florida residents, and it's quite alarming that we are the only carrier that is offering coverage in every one of our counties. There are 67 counties in the state of Florida, and Florida Blue decided to take care of all of our Florida residents. In 35 counties, we are the only provider that's going to even offer coverage. And I was quite alarmed by that because when I started getting into the healthcare reform and the Affordable Care Act, I was under the impression that if a carrier came in, they would have to take care of everyone in the state of Florida. Well, unfortunately, the way that the law was designed, it enabled carriers to pick and choose, and that's exactly what everyone else did. Every other carrier has picked and choose where they wanted to offer business. Florida Blue did not do that. We are providing insurance to every one of our Florida residents. We've already talked a little bit about the Florida Blue stores. They're for you, so that way you can utilize our services to help you in making sure that you're getting the most out of your insurance. Many of you might not know this, but Florida Blue is a mutual company, non-for-profit company, meaning that we don't have stockholders to pay. So we operate on the same minimum loss ratio, that whole 80-20 thing that you might have heard about in the news, meaning that the company has to operate on 20% and 80% has to go to pay claims. Well, instead of us having to use the 20% to pay a bunch of stockholders who bought stock in our insurance company, we infuse that money back into the business in the form of benefits, in the form of other things that are for our policyholders, because our policyholders are who owns the company. The largest network of doctors and the doctors that you want to see, the carriers, the specialty clinics, the Moffitt Cancer Centers, the Bay Care Centers, the places that you are going to want to go to are in the Florida Blue networks. Now, I want to touch on briefly, if you might be a business owner, a lot of this is kind of been going around the news. And what they've done is they've really changed the way that the business owner is going to be treated when it comes to healthcare reform. And they've put off all of the penalties that you may have heard about and all of the negative until next year. So I'm not going to spend a lot of time on this, but I do want to go through it in case we have some business owners on the phone that this is important to. If you are a business owner on the phone today, and listening to this call, you should know that depending on the amount of revenue your business has, you need to send a letter out with your plans to what you're going to do with healthcare reform. That needs to go out in the month of October, stating what your plans are going to be. Are you going to be offering coverage? Are you not going to be offering coverage? There's a lot of debate about people that are cutting employees and making them part-time employees, and small groups that are going to get rid of the insurance that they have. Well, I think we all just need to take a deep breath. You need to work with a professional to identify first and foremost what kind of insurer are you, or what kind of employer are you. Are you a large group employer with over 50 employees, or are you a small group? And what does that mean to you? What are you going to have to do? Well, it's not effective in 2014. The large groups are still going to have to provide a minimum standard of coverage, but any penalties that are going to be based upon these minimum standard of coverage and the 9.5% of the income, which we'll talk about in a second, that's kind of come off the table, and you won't have to worry about that until next year. But what you do need to understand as an employer is what we call the employees and your employee family glitch. Now, the family glitch is something that they mentioned in that video where you may not be able to qualify for a subsidy, but furthermore, which can raise some alarming aspects and some things that really should concern you, is that what about the rest of your family? So the way that the family glitch is and how it works, let me explain. If your employee looks at their W-2 and the cost of the insurance for the employee insurance cost is less than 9.5% of the W-2, then that coverage is considered affordable. And by that coverage being affordable, that means that you are now eliminating the rest of the family from obtaining a subsidy. Let me say that again. If your employee has a W-2 and the cost of their health insurance just for the employee, not the entire family, is less than 9.5% of their total income, which it probably is, then the rest of the family is not eligible for a subsidy on the marketplace. Now that's very important because as an employer, if you are an employer and you're listening to this today, as an employer, if you are offering coverage and the coverage for the dependents and the family is rather expensive, by you offering that coverage in many cases, you may be doing a disservice to your staff and your families that work for you. So you are going to want to take some time and sit down with an insurance professional to look at what the cost is. Is it better to be utilizing this new payer in town that's going to help pay for these premiums? And that is the government in the form of a premium tax credit. There are lots of different ways that you can infuse business into your business. This is something that if you're paying thousands and thousands of dollars a month in insurance costs for your staff, it's something that you may want to visit to make sure that you're not putting the rest of these families at a disservice. So let me give you an example of that. I work with a particular bunch of guys that are firemen. Now, the firemen all get their insurance for free through the fire department. But to add their families is typically about $1,500 to $1,800, depending on their age, to add the rest of the family to the group insurance. Well, because that cost of the insurance for the firemen, it's free. So it's obviously less than 9.5% of the insurance cost of his W-2, so therefore the rest of the families wouldn't qualify for a subsidy. Now they can still go to the marketplace and buy a guaranteed issue plan, get all of the benefits that are available, but they are not going to get that governmental money because of the affordability test and the family glitch. So it's something that gives you another reason to talk to one of our professionals to kind of go through that. So what are some solutions for our individuals? Florida Blue is the local company. We're going to be offering coverage to all of our Florida residents. We do have the most extensive networks in the state. Our agents are Florida residents. We live here. We know what goes on in the state of Florida. And our agency in particular has been local to Florida, selling only to Florida residents for the last 30 years. A family-owned business and a business that cares about our Florida residents. So some common questions that I hear on a regular basis, and I probably could have listed about 10 more pages of this, but I took some of the big ones. Will the government dictate my medical care? Absolutely not. The insurance company is still the insurance company, and the insurance company is going to dictate your medical care. So I don't know which one is better, the insurance company dictating your medical care or the government. But you should understand that your carrier is going to be Florida Blue. Florida Blue is going to be the company that you're going to choose the network. That's where you're going to choose your benefits. They're the ones that are going to be paying the claims. What is going to happen, it is only the government is giving money to Florida Blue on your behalf if you qualify for a subsidy. Will there be long lines at the doctor? Absolutely. There are 2 million people in the state of Florida that are now going to qualify for health insurance or get some sort of financial help to pay for that health insurance. Do you think with 2 million people that are getting into the market and we're not going to have another 100,000 doctors that we're going to have some long lines? Absolutely. So it is my advice to everyone listening to me today to make sure that you get to a doctor, establish that relationship. We've got solutions for you to make sure you can get to that doctor at a reduced rate, and make sure that you can then take that established relationship and not worry about it as we move to healthcare reform and through healthcare reform. Because come January 1, when all these people have now enrolled in a policy, they are going to be long lines. Next one, will it change? I guarantee you that it is going to change. I know that there are going to be changes in the way that it functions, the penalties, the enrollment periods, you name it, there are going to be lots of changes. I've experienced changes on a daily basis when it comes to how all of this is going to unfold and how everything is going to function. So we're just going to have to roll with it. We're going to have to be comfortable in knowing that there's going to be changes, because there are. Something that's been coming up more and more is that, oh, well, with these government health plans, which all of this Affordable Care Act, I can go get my fertility treatments. You really can't. So the policies are going to be based upon standard policies as of today. In fact, the platform or the model for all of the federal marketplace plans were based upon a Blue Cross of Florida policy. So that's very nice. You can feel comfortable that if you work with Florida Blue, that the basis or the core that everything was built around a Florida Blue policy. But for you to just go get elective surgery, I just want to go get my eyelids done, I think it's time for a little lift or a little tuck or a little something like that, or a little fertility treatment, that still would not be a covered expense, and it still has to go through the claims process as a qualified medical treatment. And the one that's a little bit alarming, what is going to happen to the people that are under 100% of the federal poverty level? Unfortunately, there is, unless you're going to qualify for Medicaid or unless you're going to qualify for a CHIP program or anything similar to that, you are still going to not have any assistance. So my best advice to anyone under 100% of the federal poverty level or under about $11,000 a year, as a single individual, you're going to have to do your best to try and infuse some money into the family's budget to get over that number, so that way you can take advantage of what healthcare reform has to offer. So what do you do next? Next step is going to really get with one of our agents, speak with one of our professionals, try and identify what your subsidy amount is going to be, what is that going to look like, talk about the plans. We know what the plans are. We all have them for you to talk about and ask questions, go over the options. And if you're an employer, go over group insurance solutions. Maybe we need to be looking at group insurance, or maybe we need to be looking at your current group insurance model to make sure that it's appropriate built. And also make sure that, are you offering a group insurance policy if you're an employer, and is it beneficial for you not to? And lastly, get the protection that you need, that you want, and that all of our Florida residents deserve. It's fantastic. Well, I hope everybody enjoyed the presentation today. We are going to be doing a series of these. I want to thank everybody for attending. It was very nice to have you all on the call today, and I hope you learned a lot, and I hope that we didn't come up with more questions that you have now. But if you do, please give us a call. You can reach us at 813-288-9500. You can also reach out to the agent that directed you to this meeting. Feel free to give them an email. And any feedback that you have about some of the questions and different things that we talked about today, I'd love to hear personally. Thank you very much for taking the time out of your evening, and I hope you have a great night.